Good morning, everyone. I'm David Mohr. I'm president of the Society for Digital Mental Health, and I am honored to welcome you to the fourth annual conference. I'm here with Bethany Teachman, who will be speaking a little bit later in a few minutes. But before we get to Bethany, I just want to say a little bit about the Society for Digital Mental Health. So we all know that digital mental health is effective. Go to the next slide. We all know that digital mental health is effective, and an overarching goal of the society is to support the integration of digital mental health into the American healthcare system. And to achieve that, we really need to have all the stakeholders working together, working across different groups. And for that reason, the Society for Digital Mental Health is really a big tent organization. We have academics like myself and Bethany. We have people from digital mental health care companies. We have healthcare represented through clinicians and administrators and leaders, payers, and people from many, many other sections. Our theme for this year is advancing digital mental health in a rapidly changing world, and that brings us together to advance research to better understand how to implement and promote accessible evidence-based solutions. So I'd like to now just introduce our board of directors. You'll see them around the conference over the next couple of days. Stephen Schuler is our secretary, John Evans, our treasurer, Sue Yun is our membership committee leader. Bethany, who's here with me now, is head of conferences and events. Cesar Escobar Vieira is our communications chair, Megan Coder, our policy committee chair, and Emma Wolf, our student representative. I want to also thank our conference sponsors. I really want to thank Otsuka Pharmaceuticals and Boehringer Ingelheim, who have been sponsoring our organization almost from the very beginning. And I want to thank Modern Health and CEO, the Office of CEO, and the High Lantern Group for their sponsorship for this conference. We also have a number of exhibitors who are also sponsors: Soitu Digital Therapeutics, Digital Health, Unstuck, Videra Health, and Otsuka Precision Health. So they will be presenting today and tomorrow from 1 to 2 on both days. Unstuck is a digital mental health tool for anxiety based on cognitive behavioral therapy. Soitu Digital Therapeutics is a game-based intervention that comes out of research at Aalto University in Finland. And Digital Health is a partner of the Society for Digital Mental Health, and they have a database of more than 4,000 different digital health solutions that support healthcare and clinicians and consumers in navigating this increasingly complex space. Tomorrow, Videra Health will be joining us and they have a note-taking and assessment platform that supports clinicians, and integrated into that are AI solutions that perform analyses on language, voice patterns, and facial expressions. And then Otsuka Precision Health has Rejoin, which is one of the first, or is the first, FDA-cleared intervention for depression. I also want to encourage you to join us this afternoon at 6 o'clock Eastern for our networking sessions where we can get together and talk as a group. The next slide. I'll turn this over to Bethany.
Hi all, my name is Bethany Teachman. I am a professor at University of Virginia and on the SDMH board, and thrilled to also be the conference co-chair this year. And I co-lead an initiative called UVA Tide, Thriving Youth in a Digital Environment. And Tide is very excited to be co-hosting the conference this year with SDMH. And we're really interested in questions of how digital technology impacts youth mental health and their healthy development. And in turn, very much aligned with SDMH, how is it that we can leverage digital technologies in order to increase access to care to support youth mental health? And we are thrilled to be partnering with SDMH in multiple ways. So this year we have launched our first digital health industry internship program. We had hundreds of applications and are very excited to be partnering with SDMH. And we have 10 inaugural interns this summer who are working in different industry settings. And we're excited to also partner with Therapists in Tech. We'll be offering a digital health industry summer speaker series. Please sign up. We've got an amazing line of speakers who are sharing the diversity of career opportunities in the digital mental health space. And then at the end of September, we will be doing a summit in partnership with University of Santa Clara on digital mental health for LGBTQ plus youth. So go to our website and you can sign up for those different opportunities. And now I am absolutely thrilled to do a big thank you to our conference planning committee, particularly to Cesar, who is my partner in crime and co-chairing the conference, and then to the amazing list of folks who volunteered their time, many who this is their second or third year doing it, to bring together an incredible lineup of speakers for you. If you see them in sessions, please, please, please pass on your thanks. They've done a truly amazing job. I particularly want to call out Tyler and Tanvi, who have been leaders for us. You've probably gotten 100 emails from each of them over the last couple of months as they have made sure that this conference runs smoothly and done an incredible amount of work. So a big thank you to them. Also, thank you to our technical support team who's going to be here ready to answer your questions and make sure that things go smoothly. And our fantastic communications team, they call themselves ComCom, led by Cesar with an amazing group that's trying to get information out to disseminate. And this takes a village. So a huge thank you to our many, many conference moderators and networking hosts. They'll be in different rooms today and tomorrow. Again, please pass on your thanks to this great team. And finally, we hope you absolutely love the conference. We've got some hashtags there. Please spread the word, post on LinkedIn, Blue Sky. If you're seeing a talk you're excited about, let people know about it and share the hashtags. So have a fantastic time. Thank you so much for joining us, and we look forward to a terrific lineup of speakers today. And with that, I'm going to turn it back to David to introduce our fantastic keynote speaker.
Yeah, it is really a pleasure to introduce our keynote speaker today, Katie Drasser, and she is a true leader at the intersection of healthcare technology and innovation. Katie is CEO of rockhealth.org, an organization that's been at the forefront of digital health, supporting entrepreneurs, conducting research on trends, gaps, and opportunities in digital health, and fostering collaboration across the healthcare system. Katie brings a wealth of experience in digital health policy and venture investment. Under her leadership, Rock Health is shaping the future of healthcare by championing accessible, equitable, and evidence-based solutions. Prior to joining Rock Health, Katie held leadership roles at the Aspen Institute, where she curated content for the Aspen Ideas Festival and was managing director for the Aspen Global Innovators Group, focused on poverty alleviation and human rights. She's worked internationally on HIV and AIDS treatment strategies in Romania, private health services delivery in Myanmar, the scale up of Kenya's national emergency medical system, and she developed Good Capital, a venture fund that invests in social enterprises like Hub Bay Area and Social Capital Markets Conference. Katie will be speaking to us today about digital mental health with a lens on youth. There should be time for questions at the end of it, so please enter questions as they go along in the Q&A button that's at the bottom of your screen, and we will get to as many of those as we can at the end. So now, without further ado, welcome.
Thank you so much, David. I really appreciate that. And a huge thank you to the Society for all that you all are doing. We are all in this together. And I'm so thrilled to also be with so many folks in this room, so much wisdom in this room. And so may I be one of many voices here of who we are all learning from. So I'm going to share my screen and get going unless we have any other business to cover. I do want to make sure we have the interpreters here. They may be a little late, but they will be here. And so I would invite the conference staff and team who have been amazing. If you need to interrupt me to make sure they're here, please do so. I think all of us will want them here, so we don't mind at all if you need to do that at any point. Okay, David, thank you for that kind introduction. Who are we? David shared a little bit about who I am. I work with the most amazing team. I always say I stand on the shoulders of giants. as it were, in addition to all of you. But Rock Health, we envision a thriving digital health ecosystem where every entrepreneur who's building a transformative healthcare business has access to capital, networks, and the support they need to scale those innovations. And we're pretty obsessed with supporting entrepreneurs. We work with all folks in the ecosystem, but we're obsessed with entrepreneurs, especially the ones who are building in some sort of untapped area of healthcare where the market opportunities exist and technology has the potential to meet that demand and improve health outcomes. We like to work where that technology unlocks meaningful progress, especially in those overlooked areas like youth mental health, women's health, primary care. And while we're obsessed with entrepreneurs, we're not precious about the tech. We see tech as a vehicle for massively transforming healthcare, which is the thing we actually really care about. And who do we do this with? David mentioned, and so many partners in the mix that you all work with. Let me just make sure. There we go. We don't do much like they were chatting about, David and Bethany. We don't do anything alone. We do everything in partnership. We collaborate with a diverse group of innovators, funders, philanthropists. We really believe that inclusive collaboration is essential to achieving systems level change. So everything we do is informed by our partners and made better by our partners. And we're continuously looking for new ways to partner, especially with those who share our vision and our mission. As David mentioned, there'll be Q&A. I'd really love for this to be interactive. We have some polls in here. As I mentioned, I'm acutely aware of the expertise in this room and that I am one of many experts and voices here. So would love to hear from you at some point. So I'm going to quickly walk through the state of mental health. I think this group probably knows those numbers pretty well. The promises and pitfalls of digital solutions, a deep dive into youth mental health, and then sort of what's working in practice and some ideas about what we can all do. Again, this is a room of experts, so these numbers well. The numbers do not lie. More than 1 in 5 people experience a mental health disorder, and only half of those who are diagnosed with mental illness received treatment as of 2021. And so there's a massive gap here. And what are those barriers? What can we do about them? Beyond that, this is costing us massively in so many ways. The cost of the system is continuing to rise. We have nearly 6 million people sought care in the ER for mental illness in 2021. Sort of an astonishing amount of need, I would say. I'm going to ask a question to this group. What do you think are the biggest challenges in integrating digital mental health with traditional care models? I want to make sure we're hearing from you early and often. So the lovely team here will pull up a poll, but what do you think are the biggest challenges? I'll give you a few seconds to answer, but lack of interoperability, reimbursement, clinician resistance. You probably want to check all of these. Mistrust from patients. Let's hear from you and just get a little temperature and pulse on what you all think. Okay, we should be able to see the answer to the poll here in a second. Let me see. Is it possible to show the results of that? Here we go. Okay, great. So the biggest one is reimbursement and payment barriers. It's sort of maddening or enlightening how much money drives how our system works and the way care is delivered. And that's evident here in this poll. 36% of you think that reimbursement and payment barriers are one of the biggest barriers. I think what this question helps us figure out is where is there alignment between some of these barriers and where some of these innovations could perhaps give us some daylight and give us some progress. I'll do a couple more polls, but moving on to the next slide. I just painted some dark stuff. We talked about I heard from you on the barriers, but is there any good news in this? Why do we have this Society of Digital Mental Health? Clearly this is a group that understands where digital innovation has a critical role to play. It really does offer a way forward but only if we build solutions for everyone, not just the privileged few. And I think that is our trick. That is our challenge. These digital tools are gaining traction. Consumers are really, we know from our data, consumers are really turning to digital platforms at increasing rates, and younger populations are especially open to these modes of care. We really see an opportunity for technology to remove these barriers, or at least reduce them, both from an urban setting and from a rural setting. We also know that these tools offer flexibility. Many youth, for instance, are seeking care through text-based therapy, AI-driven chatbots, and more culturally relevant content. But as you know, access alone is not enough here. We really need solutions that are inclusive, evidence-based, and trusted by the communities that they serve. When we look at digital innovation, there's sort of a couple things we need to keep in mind, right? Not everyone is benefiting equally from this. I think that this room knows that well and is committed to doing something about it. Nearly 20 million Americans lack reliable internet, and that affects both the rural and urban populations. If we don't close that gap, any of these digital innovations may actually deepen the disparities. So we know that digital divide is real, and who's getting left behind? Communities with lower broadband access, people with disabilities, youth without private spaces for therapy. There's also algorithmic bias. Listen, AI is doing wonderful things in many ways. It's also causing some harm, right? We know that bias in these digital tools is a real risk, and that large language models have been shown to perpetuate racial bias in healthcare recommendations. So we have to build stuff more responsibly with equity and accountability embedded from the start. We also know that privacy and trust matter. Recent reports show that mental health apps have collected and shared some sensitive data. If you want to know a faster way to erode trust, there's one. We can't be doing that. We have to find a better way to build. We know from our data at Rock Health that privacy is a top concern, both online and offline. So only 42% of Gen Z respondents from our Rock Health Consumer Adoption Survey most recently are comfortable sharing their data with providers. Only 42%, how do we get that number up? What would make folks feel more comfortable? What would that look like? 90% of older generations are comfortable sharing their data with providers. So there's some sort of generational divide there. Trust is a huge design issue and a leadership responsibility, I would say. So our team sort of got obsessed with, and actually many folks in this room, and I know folks who are talking later today, we're pretty obsessed with what we can do about youth mental health and the opportunities we're seeing, the demand we're seeing, and really grounded in a crisis. Most opportunities are, but there is sort of a unique opportunity here. Young people are truly digitally native. They're using technology in all facets of their life. Digital solutions can provide affordable, scalable, and personalized care in ways that match how young people already communicate and where they're hanging out. So if digital tools can successfully support earlier interventions and tailor resources to be more culturally sensitive and age appropriate, the sector, we think, has a real chance of making youth mental health care more inclusive and effective. I would say youth mental health is in a crisis. I'm sure we all agree on that. And yet it presents a powerful opportunity. Young people are really turning to these tools in high numbers, and especially those from underrepresented communities. Some data, as we look at this generational crisis in youth mental health, according to Hopkins, almost 22% of children, more than 1 in 5 of them, experience a mental or behavioral health disorder in 2021. That's not just a clinical statistic. I would say that's a call to action for early intervention, culturally grounded care, and systemic change. That's an astonishing number. If you look at JAMA published some research that showed about $60 million in annual medical spending across US households was driven by youth mental health needs. So it's costing us. It's not just costing our health, it's costing our bank accounts, it's costing us economically. That's a huge financial burden for families and underscores the cost of not addressing these issues upstream. Beyond the child or the young person, beyond the family, it's also impacting other parts of our society. So 53% of working parents missed at least 1 day of work a month due to their child's mental health. So that's not their mental health, that's not their child's health. It is their child's mental health is causing 1 day a month where they are not showing up for work. I have to pause and just like imagine a family with that much pain going on, that is their reality. And then more broadly, zooming out to look at that is affecting economic productivity, workplace engagement, and overall family stability. All of that data was according to Nationwide's Children's Hospital, and I think there's more to unpack there about where we might build solutions and where this is impacting folks. It's not just, within a family. Looking at some other data, so every year we survey 8,000 individuals and we consensus match, this is here at Rock Health, we consensus match by gender, age, geography, race, ethnicity, household income. And we do this, and you can see more on our website. We have a bunch of reports and new data that was just run to understand what the user patterns are, adoption trends are, what people are asking for, what they want, how they're using it, so that builders and others innovating in this space can respond to that, can take that into account. So our team looked at this data and the patterns specifically among young adults. And what did we find? We found that 61% of young adults with a mental health condition are tracking their well-being digitally. That's a pretty high number. We think it could be higher, right? If it's actually working for these young adults. But the majority are tracking their well-being digitally. We also found that young adults among Black folks and Latinx folks are more likely to try online therapy than their white peers. That not only demonstrates a demand, but a need for more culturally grounded services and meeting folks where they are. And then this last one, this is according to Lurie Children's Hospital. I particularly love this statistic. 98% of millennial parents have talked to their kids about their own mental health, about their kids' mental health. They've had those conversations. 2/3 of those parents never had those with their own parents. That is a massive generational shift and a signal that the demand is here. That really opens up the possibility for new kinds of family-centered, tech-enabled innovations that we're really excited about. And it turns out the market is excited about this too. The market's responding. $230 million in 2024, and that number is growing, went into youth mental health innovation. So venture-backed companies over $2 million, that have raised over $2 million in venture funding. 230 million in 2024. That number is growing. That number has consistently gone up. And what is it funding? On this slide, you can see that among these startups that are addressing youth mental health, nearly 1 in 4 of them support some specific treatment or condition. So they're specifically looking at, let's take a quip in the left-hand part of the slide that treats eating disorders. They are growing their business by adding more and better services for that population, perhaps linking them out to other services, but they are hyper-focused on that group. Fantastic company if you have not heard of them before. And then the majority of them, which here sit in the middle of the slide, so 63% support multiple mental health conditions or general mental health needs. So these companies often start by helping young people articulate their needs, leading to a diagnosis if necessary, and then connecting them to treatment and supportive pathways of care. And because mental health conditions overlap, this shouldn't surprise us too much. So for example, 74% of young people with depression also have anxiety. So it makes sense, and isn't that surprising that most of these startups fall into this category where they're trying to address multiple demands, let alone whole person care and other, which some of these groups are indeed doing. If we look at the type of innovation, sort of what is being funded, 89% of startups analyzed offer either virtual care and coaching or self-directed support. 26% do both. And so you can see that here, 72% are doing virtual care, 43% are doing self-directed support. This is important as we look at solutions to expand access. We know that many geographies in the US, many populations in the US do not have access to a child or adolescent psychologist or other services. So the fact that online, provided you have internet, as we talked about earlier, you can find some of these solutions that match your needs, solves for a much larger challenge. And then looking at sort of what's being adopted, I would point you to the text message one. Young folks are 11 percentage points higher in adopting text-based care, and it's something they're asking for more and more. We're seeing more innovators incorporate text-based support into their innovations Young folks are really responding well to that. And actually, when you look at young folks and stratify by race and ethnicity, the more underrepresented groups, LGBTQA groups and others, are using that type of support and finding care where they need it there. Speaking of finding care, where do folks get this care? Where are they finding these tools? Digital platforms meet youth in so many different spaces: school, work, social settings, online communities. So portability is indeed an asset, but place still really matters, especially for the most vulnerable. So when we're building these solutions, when we're thinking about these innovations, we have to consider all of these settings and how we might interact and support kids in these places. And then what are you saying? What are they looking for? Are they asking? I would point to a fabulous partner of ours and an entity that we have a lot of respect for in their track record, Circle Health. They just did this youth mental health tracker. If you have not seen it, check it out. But they really looked at, okay, well, what are youth telling us they need? What are they telling us they want? What are they saying overall about their health? 38% of youth struggled with their mental health and are still in treatment or stopped. 62% of youth who struggled with their mental health did not complete the treatment they needed. If they're not completing care, why not? What can we be doing better? It's not their fault, right? We have all this innovation, tools, and resources to build as best as possible. How do we do better? And how do we meet that demand? A huge thanks to this group for allowing us to better understand what youth are saying and wanting. And then you have companies, and some of these companies may even be on the phone. Again, these are venture-backed solutions, incredible leaders behind these companies who are really looking at how might we meet youth? How do we design? How do we fund these models? How do we reach folks? We really see these companies, there are many more, we're just picking out a few, as bright spots, standout examples of innovation meeting youth where they are. Brightline integrates care with pediatricians and payers. MindRight delivers SMS-based coaching to underrepresented youth, and Hazel Health embeds care into schools for Medicaid populations. Each of these companies has different business models. They're reaching folks in slightly different ways. Their starting points are different, and yet they're all finding pathways to care that are showing fairly effective outcomes that we should all be paying attention to. So speaking of all of you and paying attention, another poll for us: which of these digital solutions do you believe has the most untapped potential? You know, is it the model of peer-to-peer support, AI chats, school-based digital screening, gamified? What do you think? Where do you see a lot of untapped potential where we might want to be building more and better? I'll give you another second here and then we can see the results. A lot of votes for peer-to-peer support platforms, AI-powered chat, and coaching tools. I'll give you an example. So MindRight has a peer-to-peer support platform. What they found is that kids over time really liked that engagement. And then when there was something more sort of acute happening, that those relationships and that support had been, MindRight has the AI chat. I misspoke. The AI chat and the coaching tools. And over time, that sort of consistent drumbeat of care and the texting and that support made it so that when something acute did happen for a kid, that trust and that drumbeat was already there to catch them rather than waiting for that moment. And so I agree with these things and think there's a ton of opportunity. Okay, speaking of opportunity, so I'm going to zoom out a little bit from youth mental health, even though we'll still touch on it. But, you know, when we look at driving change, we have to ask ourselves, are we building with or for the communities we serve? Are we closing gaps or creating new ones? Are we measuring success by engagement metrics or real world impact? We have to think about all those things as we think about the opportunity. So let me just give a little market snapshot from Rock Health's venture database. In 2024, US behavioral startups raised $1.6 billion. That was up from 2023. And of that, youth mental health drew 33% of that total. And so I would say the momentum is real and we must channel it wisely. It is not enough to just have this funding. And quite frankly, given the need, we should probably have a lot more of the funding. But interestingly enough, mental health has been the top funded clinical indication of all digital health funding since 2018. So 7 years running, investors and other builders, this is where the bulk of the money is going. We have to also think about the outcomes, right? I said money's not enough. What is actually working? What are we funding? It's not, you could have all the money in the world if it's funding, BS. PHTI, I'm sure many of you have heard of them, just released a report, for instance, on virtual solutions for depression and anxiety. This is among adults now. To try to get under the hood of what's working, what's not. From their standpoint, they're trying to answer questions for payers of where should they be literally funding and partnering and supporting these innovations? How do they make sure these innovations are working? The whole purpose of this effort from PHTI is to not just fund baloney, but to fund things that actually make people healthier. This particular report on depression and anxiety evaluated 15 solutions. This, by the way, just came out weeks ago. That 15 solutions that offer digital programs, including on-demand digital content libraries and activities for those with depression and anxiety. Some of the solutions were more comprehensive, including integrated care from clinical providers. Their findings indicated that these virtual tools, just overall, you should read the report in more detail, but can drive measurable improvement for people with mild to moderate depression and anxiety. But the impact varies, and we need more and better evidence. And really, our team is very supportive of anyone trying to figure out what's working and how we get sort of smarter payment alignment and really fund things that are indeed working. And we can also look from a policy standpoint, just look at what states are doing. States like Utah, California, and Louisiana are investing in mental health through workforce grants, expanded screenings, more flexible prescribing policies. There's a bit of a tailwind for innovation in this space. We need to keep paying attention to this, fighting for this stuff. But all of this starts to create windows of opportunity for more and better innovation. So over to you. What do you think? We just mentioned, right? What Sergo is doing, what PHDI is doing from a policy standpoint. As you're looking at effective ways for all different sectors and different parts of the ecosystem to collaborate, to scale the impact of digital mental health, where do you see the opportunity? What do you think would be most effective for collaborating? I'll give you a few seconds here to answer this poll. Okay. The majority of you put all of the above, and I think that's right. I will say collaboration's hard. Many of us here collaborate. Very few entities are paid to collaborate. We're expected to collaborate. I just give a ton of credit to those who are doing it well. It is going to take all of us to not make this another tech trend, right? To not make this just something that passes us by. We actually really do need to be working together. As we think about what it is we could be doing, we have a lot of thoughts. I'm sure you have a lot of thoughts, but everyone does have a role to play in expanding access, building a strong, culturally competent workforce, empowering youth and families, prioritizing inclusion, embedding mental health in education, and designing tools that are safe and human-centered. As I mentioned in the beginning, we do a lot of our work in partnership with others, much like the society here is cultivating, but we look to entities like Hope Lab, Fiore Ventures, BHT, Pivotal, Gray Matter, Sergo, and many, many others for their work and their leadership. But it is going to take all of us. These are just a few ideas. I'm looking forward to hearing yours. If we're going to build this intentionally, ethically, and equitably, we can transform mental health care for an entire generation. But let's make sure we get this right. It's not enough, right, to just try. We have to not just build mental health for some, we have to build it for all. These are a few ideas of how we can get here, but I really appreciate your time and your listening and look forward to your questions. But I'm I know we share a collective commitment to reshaping the future of mental health, and excited to do that with all of you. So thank you. Thank you for having me. Excited to hear. I think David's going to join, and I'm sure you all have questions, and I'm eager to hear them and eager to hear from the other panelists as the day goes on.
Well, thank you, Katie. That was a wonderful talk. And we've already got some questions that have come in. Let me start to pull these up. And I've got a bunch. So there's a couple of questions on AI-based support. So one is kind of, you know, the person says they believe they could build better ones, but the question is, you know, should we?
Right.
And then also, you know, could you expand further on AI-powered chat and coaching tools, and give some concrete examples and metrics of what you've witnessed?
So let me tackle it in a few ways. So let's start with AI and just zooming out broadly. I think a lot of the conversation that our team is hearing around AI are all the problems, and there's a lot of reason to be worried. But AI is not going anywhere. And I actually think what we're missing are the solutions that are actually making our healthcare more equitable. And there are many examples, and we don't hear enough about them, of where AI is actually accomplishing our goals. And I think we need to be looking to those examples and looking to those models to do more of. When we talk about, you know, how bad the data is that AI is using, or, you know, that it's biased, well, the data is already biased. We're already all working in a system of bias. There are ways in which AI can actually shift some of that. If we design for that and pay attention and see AI as a partner in some of this innovation. One example I'll give you, and this sort of starts to get into the chatbot example, and where AI can help with coaching. So there's a company called Marigold Health. They don't just serve youth, they serve all folks, and they have a peer-to-peer AI-supported coaching program. And what they have found, they're in their early days. There's still a lot to be learned and understood, but they have about a 90% effectiveness rate. And what they're doing, they serve folks who have substance use disorders and alcoholism in particular. And when you look at, if you're somebody trying to recover, someone you might trust is someone who's been there. And so what the AI tool is doing is actually equipping those peers in recovery to better support and be a peer to others who are trying. Not only that, they're paid. And so to me, when I look at that example, we say AI is taking away jobs. That's an example where AI is actually supporting folks to do what is otherwise unpaid work. That's an example where AI is actually driving better health outcomes and effectiveness by supporting those peers. And it creates sort of red flags when something comes up, and gives those peers additional content or resources to share with the peer in recovery. And so I think there are many ways to do this, but those are some examples. And our team is really looking for those sort of counter narratives of where AI is actually contributing to making our healthcare more equitable. And again, I gave you a few examples. There's countless ones, but I think we need to be telling those stories just as often, and maybe even more, than we are talking about the bias and the risks and the harm, which are very real too.
All right. Another question here is the questioner asks, what role can psychologists play in influencing funding for digital mental health tools and apps? And I would just broaden that to, you know, what can clinicians broadly, you know, what role can they play in kind of supporting the you know, the rollout of digital mental health and funding?
I love that the folks who are already doing so much are asking what they can be doing more of, which is just sort of right on the money. Let me give an example that's actually outside of mental health for 1 second. We were in Kansas City, the Rock Health team, a couple weeks ago with a group of family physicians supported by the American Association of Family Physicians, AAFP. The whole purpose of that gathering was where AI can enable more and better primary care in the US. And what was interesting, much like this question, is the providers in the room, the clinicians, the physicians, nurses, et cetera, in primary care in that case, we're so delighted to even be in the room. We're so delighted to be a part of the innovation cycle for some of these solutions that are being built, and have real thoughts on how these solutions can be better. So I actually would not put it squarely on those folks of like what more they could be doing. I think the builder community needs to be listening to these folks more. And so what could you do? Reaching out to those communities, paying attention to where there are startups and others, investors and tech companies and others actually trying to listen to the folks delivering care, and jump into that. Give them your feedback, make these products and tools better, test and iterate, prototype, be willing to try a tool or two. Perhaps ask one of your clients or patients, what do you think about this tool or that tool? That data, that real-time data, listening to kids or patients and whoever you serve, I think is really important. It probably sounds small, but I actually don't think enough of it is happening so that these innovations can actually be better than they are today.
All right, thanks. And I'll just also add, if for clinicians or people, if you're involved in your professional organizations, I mean, SDMH is a big tent organization. Encourage your organizations to get in touch with us. We do collaborate with lots of different organizations. We are a very collaborative organization. So another question here: how do you think recent IPOs of digital health companies outside of the mental health space affects the industry and the future of funding for digital mental health companies?
I think it's a good thing.
Yeah.
Investors early on are more hesitant to put money in if they don't see. And again, we're talking about venture-backed investors. I need to pause and say there is so much money in the healthcare space and creative ways we can be funding these innovations. Venture is one of those ways. And not every innovation is fit for venture, and we don't need every innovation to be. So the ones that are fit for venture, which include a pretty rapid, scalable model, those investors are not going to fund early if they are not seeing exits on the other end. So these recent exits give a little bit of, I would say, new fervor and momentum to the sector, that there are pathways from a venture standpoint to scale impact and innovation. I'm particularly encouraged by the recent IPOs. I happen to know some of those entrepreneurs. They actually care that people are healthier. Those leaders and the people behind those companies, Hinge and Omada, actually care that people's health is better. They are not just in it for the money. But somebody in here somewhere needs to make money, and that is happening. And I think that will help some of these earlier stage companies.
Yeah.
And really help. We saw a bit of a drop off, I would say, in growth stage, so Series C and D. And I think this might jumpstart some scaling what we know is already working, but for those companies that haven't necessarily been able to find that funding to grow.
Yeah. All right. Another question around AI. I suspect there'll be a lot. So my teen patients are usually using ChatGPT in the middle of the night as a therapist. I have them read me their prompts, which is actually a really good thought record in the middle of the night when they wouldn't fill out a PDF thought record. As a clinician, how can I contribute to making these tools, which teens are already using, safer and more evidence-based? And I think sort of broadly that gets to kind of this question of kids are using it, and sometimes it works. Sometimes, we've probably seen in the press where it goes disastrously wrong. So, how should this, how can people support the development of safe and effective evidence-based?
I think it's sort of getting under, it's a great question. I think it would be getting under what's driving that. I have some young folks in my life, I'll keep their anonymity. They're using ChatGPT for therapy. They're using it because it's right there with them when they need it. It's free. I mean, other than the cost of your monthly, it's free. A lot of this stuff is very cost prohibitive for a young person who doesn't have a job yet or has, student debt or what have you. For adults too, right? People are having a hard time making ends meet. And so this is a way for folks to get some real-time care. So what's underneath that? For me, that's how do we make these innovations more real-time? How do we make them more affordable? How do we make them reach people where they are? How do we design for that? And I think they're using these tools like ChatGPT and plenty of others. We can build off these tools to make them safer, to make them more reliable, more effective. And I think there's plenty of opportunity to do that. But even the fact that the questions being asked is encouraging. And I think we just have to keep, paying attention. I don't have all the answers. Probably, panelists throughout the day, and you, David, and your team who has thoughts on this too. I'd love to hear them. But I think we have to get under what's driving that to build from that. Folks are telling us something by that behavior.
No, there's certainly a need, and there certainly is as you said, I think it's something that, regardless of how we feel about it, it's going to be part of our future. And so the question is, how do we make these, ensure that these are consistently safe and effective?
That's right.
Yeah. Another question from a student here, about how they can contribute to and collaborate with industry partners in this space. I'll just mention at the beginning, in the introductory remarks, Bethany mentioned the internship program that SDMH and TIDE collaboratively run. But do you have other thoughts we have a fair number of students involved in the society and here at the conference. What advice do you have for them?
I'd love to hear what they think, but what I think is use the society, for instance, to have your voice heard. When we looked at and gave recommendations to investors on what youth mental health solutions to fund, we said, don't fund anything that's not actually listening to youth or having them a part of the design process. Well, these companies and you'd be surprised, they are looking for you. And so I think if you can be sort of loud and raise your hand, create a council of, we're here to give feedback on what we think is working. Somebody is going to want to hear from you. Not just investors, but these companies. We know for sure that these innovations will only be better, more widely adopted, more trusted if youth are actually literally a part of the design process. They are in it. And giving feedback, not just once, but over and over iteratively. So don't be shy about that. Raise your hand. People want to hear from you, is what I would say. And it's actually like imperative from a business standpoint. It's not just because it's like, makes people feel good, because that's, this is like a real business need. And so make your voices be heard. Sometimes we all can't find each other, right? If you're hanging out at a college, I'm hanging out, how do we find each other? And I think some of these online spaces are one of those, and certainly the society and other entities like it.
Thank you. So another AI question here. With tens of millions of people already using the simple raw ChatGPT for mental health support, it's arguably by far the biggest digital mental health solution in use today. What does that mean for the digital mental health landscape? And should we shift our focus away from building and into how we can get the most out of this extraordinary phenomenon? And I guess that it's I sort of add on to that kind of, what's the role for digital mental health tools that aren't necessarily, leveraging AI? Is that?
Yeah, I think we could probably all agree that many of us like to go for walks and meet people in real life, and let's hope our real lives offline are as vibrant as they are online. And what we found in the consumer adoption data that we have among young adults, that once you hit a certain level of acuity, you actually drop offline. You're not necessarily dropping care. You're often going to a more in-person, in real life setting at that point. And so I think we have to pay attention to that. I don't think that, the human connection is going away. I certainly hope not. I think it's right-sizing the balance between them and taking that into account in these innovation cycles. And so where is it most helpful for folks to meet in person? And I'm giving meet in person as sort of like an example of a whole bunch of things. But I think we have to kind of figure that out and pay attention to that. It is not true that all healthcare will be delivered online and virtually and digitally forever and ever to the end of time. People still need each other. We just have to balance that out and right size it and make sure the tech isn't over indexed compared to what we may want, between humans. So I think that balance is our challenge and the trick right now.
And kind of a related question here, how do we prevent misinformation and misinformation and ethical, I'm not sure exactly what this is, but misinformation and ethical issues in the case of AI tools.
If I knew the answer to that, like I would be a gajillionaire and would invest in all of you. But what I can say is, one place we see a lot of hope is if you look at entrepreneurs that are building from their lived experience and among the communities that they're building for, and there are plenty of entrepreneurs where this is true, they are building with trust from the start. If you were building with trust from the start, mistrust, disinformation, and some of those risks you mentioned in the question that's being asked start to go down. And so I think, again, this is who are the humans behind the tools and how might we come together? Who are we trusting? Again, there is a business case to invest in those entrepreneurs. They fundamentally understand and come with trust. So whether you are a tech company looking to partner with one of these companies, or you're an investor looking to invest, I would say they have a competitive advantage from a business standpoint because they are coming with trust at a time when trust is really being eroded in a lot of other spaces. And so that's one place I would pay attention to and get really excited about. And again, you can go to our website, rockhealth.org, but also I'm sure the society has it too, of an overwhelming amount of entrepreneurs who bring that reality to their innovations that we're really encouraged by. And by the way, more funding should be going to them, but that's another conversation for another day.
Yeah. So, we've talked a lot about digital mental health for youth that are, who are generally more comfortable with tech. So this question is asking, how do you see tools being adapted for and applied to other populations, such as older adults who may have different levels of sort of tech literacy? And are you seeing startups focused on the needs of those other populations?
Yeah, there is on our website, oh God, I forget the name of it, but we stratified our consumer adoption data, the analysis we did most recently by generations. And one thing I would say is that the oldest slice of those generational slices were some of the highest, fastest, most widely used adopters of these tools. Our team suspects there's a bit of a misnomer that older generations are not using these tools or trusting them. They might be trusting them too much. But we actually find a high opportunity and high usage among that group who are actually leaning on these tools in really important and meaningful ways. And so I think most good entrepreneurs see that opportunity and are trying to figure out, okay, then again, like we were talking about earlier, what's the right balance of sort of the human interaction versus the tech, and what does that look like? We did find that oftentimes older folks, they need a phone call to start their online digital experience, which, like, I don't know, back in the day, the phone was sort of the internet, right? Like that was the tech, right? That like people thought was gonna, and so, okay, so start with the phone call and then, get people on your digital platform or what have you. And so I think it's just understanding those entry points and what they're looking for. But I'm pretty encouraged by what older generations are doing and how they're using a lot of this tech that I think we should all be fairly wise to. I can't help but point to what AARP and their venture lab is doing, what the SCAN Foundation is doing, just incredible work among older generations to really figure out, meaningful and impactful solutions for their care.
Yeah, no, I mean, that's certainly what we see, that, older adults sometimes are a little anxious and need a little bit of support. But once they get on, older people tend to do what you ask them to do much more than youth. So they tend to be much, the engagement tends to stay much stronger. So another question here is how can we effectively break down some of the common hesitancies among patients about digital health interventions, like the privacy concerns, tech concerns, amidst the landscape of media stories and so on, that aim to simplify social media and digital technology as good versus bad, with an increasing focus on harms rather than considering the nuances. So, sort of, I guess this is sort of like, in journalism, you want
just a few hairy issues in that
that's going to be, that's sort of one-sided and, gonna, people
Yeah.
up.
I would go back to some of those entrepreneurs and how they're building and paying attention to them. We also just ran a report on, we were looking at the difference between men and women in their usage of digital health. One thing we found is women are less trusting of a lot of these spaces. They search for this stuff almost as much as men, but they trust it less. Where we did find they were finding trust, and I think this is a design challenge for us, all of us, to remember, is among their peers. And so actually, a place like Reddit for women, a group of women trying to navigate some sort of health challenge, is actually one of the more trusted spaces. But what's underneath that is they trust each other. And so I think, again, looking to some of those entrepreneurs and other innovators who are using peer-to-peer learning and resource sharing is really important. I'm sure all of you, like the first person you ask about, let's say you're having a mental health thing, often it's like your friend, it's one of your peers. And there's nothing wrong with that, actually. Let's pay attention to that reality and build with that in mind. And a lot of folks are doing that. But we found some surprising data around that, sort of where folks trusting info and leaning on each other. And I think it gets a little bit to the heart of that question, which has many different elements to it. So I know I'm only sort of touching on one element of that multi-layered question, but yeah.
Yeah, yeah. All right, here's a question that kind of gets at something I was wondering about. So this person's asking, what do you think the opportunities are to bridge digital solutions with in-person community-based solutions as we delve into a digital first or even AI first world? One prediction is that in-person interactions is something we should be promoting and boosting in mental health. And I guess that gets to kind of one of the things I was wondering about is, your poll about what is one of the, what are the biggest problems. I see, the fragmentation of our healthcare system is really one of the biggest ones. And, if digital tools are just like one more thing out there that is fragmented and not connected, it's not gonna help. But with data, we have the opportunity to begin to drive some integration. And I wonder if you can kind of speak to, and I saw you mentioned a few companies that are doing that, but can you talk a little bit about that integration from, if we have kind of digital first, how do we make sure that people end up getting the treatment that they need? Because not everybody is going to respond to, it's not a magic bullet. Not everybody's going to respond to a digital treatment.
That's right. Zooming out for 1 second, the banking industry went through this sort of digital transformation. We always sort of joke that, like, I don't say like I digitally cashed a check today. I'm just like, oh yeah, I cashed the check. Most people don't even have a check. You're not really, it is so seamless how digital the banking world is. I think the healthcare space will become that too. Eventually, it's almost there. And so this notion that like everything is online or digital is not necessarily true. It's just we interact the way we need to. So that's like the first thing I would say, which is a little bit what I was saying before. The second thing is there's an awesome organization. I'm enamored by them, called Young Futures. I'm a mentor for them. It is all young folks designing solutions around mental health. They're fantastic. I work with a gentleman named Salman Bhatt at Stanford. He has a app and an innovation called Look Up. The whole purpose of that online tool is to find each other offline and to create moments offline to care for each other and for our mental health. It is a small company to start, but it's growing. So I think this notion that like the more online, like the digital tools make us more online, sometimes the purpose of these tools is to get us offline or to find care. In this case, as part of this question, how do we find care offline? Or, more directly from a human? I think we're still figuring that out, but I think there's some like myths and misconceptions to unpack to make sure we're understanding that the digital tools and the digital innovations are not all digital. They're just meant to like get you quicker to care or get you, to better care with a provider that more and better understands you than maybe the one that's around the corner from your home, right? So I think seeing a little bit more fluidity, I think will be helpful to all of us as we are innovating. And I know, again, like with most of these questions, that is a small answer to a big question. I'm excited to hear from others, but those are some thoughts, and definitely look up the company called Look Up that Salmon runs. It's really cool.
Great. Well, I want to thank everybody for putting in the questions, and I apologize to those that we, put in questions and we weren't able to get to them. And Katie, thank you for a wonderful, inspiring, and informative talk. We are now going to go into a break, and please come back in 10 minutes to join us in our the next panel. Thank you very, very much.
Thank you for having me. I can't wait to hear from all of you and meet you.